I wanted to discuss MS and aging. And how does MS change with age? As many of us know, our lifespan is increasing generally, the general population, and the lifespan for MS patients has increased also, primarily due to the disease-modifying therapies. We are now diagnosing earlier, we are now putting patients on disease-modifying therapies earlier, and so their lifespan is pretty normal compared to other people in the general population. Most patients can expect to live up to their 70s and 80s, even though that they have MS. So, however, the problem with living with MS at an older age is because older people generally get other diseases. For instance, in the United States, the most common disease for people over the age of 65 is arthritis. So if you have MS and then you get arthritis, it can really impair some of your abilities to walk, your ability to move. It's very normal for everybody to get arthritis, and MS kind of is a confounder. It confounds some of those problems. Also, if you had a symptom like spasticity and now you have arthritis, sometimes the healthcare provider and you together have to tease out which is the problem. Is it the arthritis or is it the spasticity? Fatigue also. As we age, we get a little more tired. And is the fatigue from MS or is the fatigue from aging? So things change as we age. Normal aging changes our whole life. And so with MS or with any chronic disease, you might find different problems. In mental health, it is not unusual for older people to have somewhat of a depression or perhaps social isolation, which means they're at home a lot. Their friends have passed on or moved away. And with MS, this is the same. So there might be some depression due to maybe more dependence upon others. An older person may not choose to live with their children, but have to live with their children because of many other reasons. So these things can make people a little more depressed. But there's very good news with MS as we age. And so I like to say this because I find with my patients and the populations that I study that older people adapt to MS. And it is easier generally for a person who is older to deal with MS than a younger person who's just starting out. If you've lived with MS for about 20 or 30 years, you're pretty well used to it. And not only that, when you're 65, you may have MS, but your friend might have heart disease, and another friend might be struggling with cancer. So everybody seems to have something, versus at a younger age, you're kind of on the outs. You're an anomaly with a chronic disease like MS. So it's not out of the norm for an older person to have a disease and for you perhaps to have MS. And although people with MS may be more disabled, their emotional issues are less than their counterparts who are younger. So a lot of MS patients say that they have better mental health than their physical health. And that's because they might be disabled. However, they're okay with it. They've lived with this all these years and they've learned to adapt. So managing new and changing symptoms are so important with MS. It is so important, I can't tell you how I stress this, to see other healthcare providers, not just your MS healthcare provider. You might have to see a cardiologist. You should generally always have some kind of family practice or internist, someone to take care of your general health. You might need to see an ophthalmologist because your vision is changing. For women, you should definitely get your mammograms and your an OBGYN to see, for your women's health issues. And you have to have regular screenings. Over the age of 60, it's important that people might get the shingles vaccine. Well, as an MS healthcare provider, I would not give you that. I would not give you the flu vaccine. I may not give you the pneumovax. These are important screenings and important vaccines that you may need. And so I stress to you that as you age, make sure you have a good relationship with your healthcare providers, not just your MS healthcare provider. And lastly, include your care partners into your life. It's so important that you are a team, whether your care partner is a significant other, a good friend, a child that helps you. Include them into your life, include them into your care. Let them know how you're feeling, and let them know that you're adapting with this, because it's important. Our care partners tend to worry about us more than we worry about ourselves. When you're feeling good, let them know. If you have a problem, let them know and ask them to help you contact or see your healthcare providers. Aging with MS has changed. It is more important that you stay vital and you stay healthy, and your MS will stay at bay at that point. Thank you.